So one of the things that I think it's very important to recognize as horse owners is the older maiden mare is going to have specific challenges unique to them. And why is that so? Well, we're starting from scratch in a mare that's never had a baby, and now she's 15, 16, some have even bred at 18 years of age. And the changes that occur to mares that have had foals still occur to mares even when they haven't had foals on a couple of points. One is the aging of their oocytes, or the eggs. Those are going to get old no matter whether they've been bred or not. Okay. The other thing that's going to change is going to change the quality of the endometrium, or the ability of that mare to be able to feed the developing embryo properly and enough. Okay. Those two things are going to change whether a mare's been bred or not. The things that are going to be unique to a maiden older mare is that her cervix is never going to have been opened to foal. And so when a mare comes into heat, they produce edema and you have some fluid. That's normal. But in older mares, their cervixes are very tight. They don't relax properly, and they can become a little bit fibrotic, so that they don't allow fluid to go out normally. And that happens also once they've gotten bred. When a mare is bred, they mount an immune response. So they get a normal inflammatory response. And that mare is going to contract her uterus, and she's going to open that cervix and push all of that inflammation out. In the older maiden mare, what happens is that cervix doesn't relax properly, and her uterus may not be able to contract enough to push the fluid out. And so she's going to need a lot more help in order to, one, relax the cervix, and to get rid of the fluid both pre and post breeding, because she's not able to herself. There are lots of different things that veterinarians can do to help with this process, so it's not lost, and you can in fact try them. The other thing that you can remember is that you can bypass all of these issues with an aged uterus by doing embryo flushes. So not just breeding them naturally, you will flush an embryo out of the mare after breeding, about day 7 or 8, and then you take that embryo and you put it into a younger mare's uterus. So we're bypassing the older mare's uterus, and we're using a nice younger mare to provide an environment that that embryo can grow. The other thing that you can do in older mares, as well as in younger mares that have a baggy uterus, that aren't able to clear their uterus properly, that may have chronic infections, is that you can do transvaginal aspiration of oocytes, in which you can go in and you can retrieve the eggs from a mare's ovary. And again, by getting the eggs directly from the ovary, you bypass all the other parts of the reproductive tract. You take that egg and then you can inject the sperm. It's called intercytoplasmic sperm injection. So you can inject a sperm into that egg, have it fertilized, and then you can transfer that embryo into another recipient mare that has a nice, happy, healthy uterus. So there are lots of different options for older mares and for older stallions that we have to remember, that we just need to work together, consult your veterinarian, your nutritionist, your farrier, your dentist, and that we can all work together to try and produce a happy, healthy foal.